Hi, my name is Dr. Ryland Gore, and I am a featured woman in the October 2023 issue of the Bold Maven magazine.
Can you share a little about what you do?
I am a fellowship trained breast surgical oncologist, so that means I specialize in treating benign and malignant disease, breast disease.
What schools did you attend?
So, undergraduate, I went to Furman University, which is in Greenville, South Carolina. From there, I moved to Washington, D.C., where I attended the George Washington University School of Public Health and got my master's in public health. From there, I came back home, went to Morehouse School of Medicine for my medical degree. After that, I moved to Chicago, Illinois, where I did my general surgery residency at Rush University. Medical Center and Cook County Hospital. And then I moved to Brooklyn, New York, where I did my fellowship in breast surgical oncology at Maimonides Medical Center.
Was this something you've always wanted to do?
You know, I've always wanted to be involved in women's health, but I just didn't know that I would be able to do that as a surgeon until I went through my general surgery residency. I initially thought I was going to be an OB-GYN actually, and so my master's in public health was in maternal and child health, but then when I got to that OB-GYN rotation in medical school, it was pretty tragic. It was pretty bad. So I moved forward with the general surgery, and it's one of the best decisions I've ever made. And then as I was going through my general surgery residency, being able to do breast, take care of breast cancer patients, it was extremely fulfilling. And I realized that's when I was the happiest during my general surgery residency. And so that was a very natural decision for me.
What does the average day look like for a breast surgical oncologist?
You know, most of it is spending a lot of time in clinic. And so I have 2 clinic days and 2 operating room days. And so during those clinic days, I'm seeing new consults, new breast cancer patients, or new patients who don't have breast cancer but have other surgical issues that I need to take care of. And then on my operating room days, I'm in the OR all day taking care of these women and evicting cancers.
Can you talk about your decision to step into private practice?
So I think that was a natural progression. And I think when it comes to medicine, the corporatization of medicine and how the industry is changing so much, I think it is so important for women and minorities to have things that they can call their own and to be able to be in leadership and to be able to make decisions and do care, whether it's in the medical field or not, be able to do it the right way. And so for me, it was a natural progression, and I'm really excited about that. I'm still a newbie. There are others here who've been doing it for a very long time. So I'm still in the baby stages, but it's something I'm extremely excited about.
As you've moved into this new transition, have any unexpected challenges come up?
One thing that nobody tells you about as you try to go into business ownership is the number of no's that you will get, whether it's from the bank, whether it's from, other people that you want to work with to begin to help build your dream. And so on the medicine side, I'm used to no's and I'm used to being like, I'm gonna do it anyway. But for those who are a little bit weaker or don't have as much self-esteem, it can really be a dream killer. And so I encourage people to know who they are, know whose they are, and really hold tight to that dream and don't let anybody take it away from you. But that's what surprised me the most.
What advice would you give other doctors hoping to open their own practice?
Keep moving, keep moving. Believe in what you're trying to do. Know that you have something to offer, to your city, to the world. Know that you are the best. Know that you stand apart and that there's no one like you. And so if you have a dream, you have to go for it.
As it is Breast Cancer Awareness Month, can you highlight an aspect of your industry that is lesser known?
I mentioned this earlier. We know about the statistics for women. 1 in 8 women, period. It doesn't matter whether you have a family history or not, will get breast cancer at some point. I think another thing that we don't know is the way minority women and Black women are affected. We get breast cancer at the same rates as white women and our other counterparts, but Black women are 40% more likely to die from breast cancer. We are more likely to have the most aggressive breast disease. We're more likely to be left behind at every single stage of breast cancer screening and treatment, all the way from screening to survivorship. And so this is an ongoing conversation that needs to happen, not just in October. We need to be talking about this every single month, every single day, holding others in our lives accountable, making sure our family members, our friends, our sisters are getting their mammograms. And we need to also check on our men too. And I know it sounds like a cute hashtag when, somebody's about to get married or somebody's going through something, but what about our men's health also? Black men's numbers mirror that of Black women. And so while they get diagnosed at the same rates as white men, they don't do as well. And so this is something that we need to be mindful of all the time. Men represent 1% of breast cancer cases each year. So holding each other accountable, checking on each other's health, and if you feel something, say something.
How can our audience reach you?
I'm on all social media except for TikTok. I refuse to go down that rabbit hole. But on all accounts, I can be found at Ryland Gore MD, RYLANDGORE MD. And my website is www.rylandgoremd.com. That's all for now, but you can learn more about me on theboldmaven.com.